Good afternoon. I was about to say good morning, but we are officially in afternoon. And welcome to, I would say, a special edition of Belly to Baby because it's on a Tuesday. And with the holiday weekend coming up, we know that a lot of people have plans to get out of town on Friday. I am one of them. So we are going to be talking about choosing a pediatrician on Tuesday instead. My name is Abby. I am 27 weeks along. I keep trying to add 1 week to my math, and it's not catching up correctly. Yes, but I swear the email this morning said, congratulations, you're 27 weeks. So it's a really opportune time to be talking about picking a pediatrician, and we're with Kristen Bruno with Purely Pediatrics. You are a pediatrician here in the community, and you're at the Specialty Care Center out on Mason Road. So that big, beautiful white building that you see along the squares. Yes, with colorful squares. That's where she is on the third floor there. So welcome, and thank you so much for joining us.
Well, thank you for having me.
It's such an important topic, and it's one that I don't think, we are so absorbed, especially in the context of this show, talking about what's happening with mom's body and everything that's changing, and there are a lot of things to address, more than you would ever guess.
It's huge.
It was like a Dr. Seuss book, but I know that at my last doctor's appointment at 26-ish weeks, I was asked, have you picked a pediatrician yet? And I know in my instance I have because of where I work, but I think that question would surprise a lot of people so early. And you say that's about the time you start really just sort of considering it. So can you tell us a little bit about the process of picking a pediatrician, and we'll start with just the when you need to be doing it.
Sure. So most of the patients that I see that come in the office to talk about pediatricians to interview are somewhere in that third trimester. So in the last kind of 12 weeks of your pregnancy is typically when you're coming in to start talking to pediatricians. Now a lot of people will start preparing as early as like the 26 weeks, maybe with starting to go and get some recommendations, go online, do a little bit of University of Google searching, and then start, mostly I see them coming into the office to meet me probably in that last 2 months is when that tends to happen.
All right, yes, right as the crunch time of everything. A friend of mine said the other day, I said, I'm so chill about everything. Really, there's nothing Amazon can't deliver in 2 days, no decision I can't make. And she's like, you'll be fine up until about a week before that baby's born, and then you're going to lose your mind.
That's right. That's right.
No harm in thinking ahead a little bit. And I should mention, I have a couple of pages worth of questions for Dr. Bruno, but if you have questions, please feel free to type them into the comments section. We will address them as we're able as we go through this broadcast, and if there are those that we don't get to or don't know the answers to, we'll do a little research and get back to you in the comments there, so we don't leave those just by the wayside. So I know that there are a lot of different kinds of doctors out there, but is there anything in particular that you should be looking for when it comes to choosing a doctor for your child?
Sure. I think it is very important to look for a board-certified pediatrician. This is somebody that has completed a 3-year residency in pediatrics, has passed their boards, has their certificates. I think that's really important. There are, like you said, there are a lot of other specialists in that area, but when it comes to taking care of your child, children are not little adults. Pediatricians are specifically trained to take care of your baby from the time they pop out to the time they're heading off to college.
So that is, they go straight through college with pediatricians?
Sure.
Patients that late?
Yes. Some pediatricians see even a little later than that. I personally see through about 21. Some pediatricians will go even a little bit longer, depending on what the circumstance with the family is.
Well, and that's a broad range of topics that you cover in that amount of time, too. You go everything from mom breastfeeding to, you talk about HPV vaccines and going off to college and the host of issues that a child would anticipate there, depression, all of these things. Is that all something that would be covered within the context of a pediatric?
That is all a pediatrician. That's what we do, exactly. Your well visits, which occur very frequently in your first year, is really all a time of education. We give you lots and lots of information, and we answer lots and lots of questions, and that's what those first visits are in the first year of life, making sure your child is on track with their development and their growth, and that you have all the best information you need to be the best parent for this child. So we're just there to support you, and as the years go on, every time you come in, it's again more education and more preventative guidance to just make your family as healthy as they possibly can be.
And what a valuable resource too, considering I know that there are so many things that along the way people will say, and my last example was, have you felt any contractions? I would have to say, would I know? But I think it's the same is true of parenting. I mean, everybody does this for the first time at some point. So it's nice to know that there are experts out there that you can trust who have seen other cases before. And every family is unique, but at least you have some guidance to give based on every other kid in the world, that you've seen, or in the world of your practice that you've seen. And you mentioned, the care that begins from day one through the end, it varies tremendously. I mean, we've done this program in concert with the Women and Infants Center at Barnes-Jewish Washington University and St. Louis Children's Hospital. In the last few weeks, last week we were in the newborn ICU at Children's.
Oh, yes.
A couple weeks before that, we were at the Heart Center at St. Louis Children's talking about about congenital heart disease.
Sure.
So you have kids who are born with a range of circumstances, everything from congenital heart disease to neurological issues like cerebral palsy. And as of last week, I was telling you before, I have a friend who has twin preemies, and she's like, do I need to look for someone who is specific to preemies? How do you go about deciphering which physician cares for which issues?
Yeah, and all pediatricians are trained, fully capable of caring for any group of children. So whether you've got somebody that's got a significant developmental delay, whether you've got a preterm baby, whether you've got a healthy 16-year-old, we can all do all of it. But there are certainly niches. So I think in the preterm community in particular, it's a very tight-knit community, as you probably saw going through the NICU. I personally see a lot of preterm babies myself, and so I can tell you that these moms really talk to each other. There are support groups that come out of the NICU. The NICU nurses know which doctors are going to be NICU baby friendly, is I guess the way I would say it, is those of us who are very comfortable with the sometimes very complex needs of a preterm baby. I think it also really helps when you're looking for care for any complicated child, whether it be a NICU graduate, a preemie baby, or somebody with maybe a complex congenital heart disease or autism, whatever it be. If there are complex medical issues, it's really nice to be in with a pediatrician that is kind of attached to a major children's hospital. So, one of the pediatricians within the children's network is really nice because all of the notes are there in the system together. So if you go and see the NICU doctor in your follow-up visit, I see that when you come in to see me because the notes are all on the computer. So it's nice to have that continuity of care, I think.
That is great, and it's a great advice too to talk to your OBGYN for recommendations.
Absolutely.
And to those nurses. Those nurses in the newborn ICU and the nurses in labor and delivery, I don't think we could sing their praises loudly.
Oh, they're amazing.
They're incredible.
Yes.
And they know the ins and outs of taking care of these kids better probably than anyone.
They do.
Because they've been doing it for so long. So I think those are great resources to mention. And also, is it fair to say, and I say this having asked friends for recommendations on my own behalf,
sure,
can you just ask your friends?
Absolutely, and you should ask your friends. I mean, nowadays, Facebook and our moms groups are huge. And so you should go out there and ask your friends. When I have a question about what camp to send my kids to, I go on my little Facebook mom group, hey, who's got a good, tennis camp? Who's got a good whatever? You should absolutely put out there questions about what kind of pediatrician you could go to. And everybody will give you their advice. And you'll see 100 different opinions on pediatricians when you ask your friends. Everybody will have a different one because the fit's really important. So, definitely take all of your friends' advice though and ask them why they like their pediatrician. What is it specifically that they like about it? Because it may not be the same thing that you want. Perhaps they want, to see the same doctor every time, and so they want a small office. Or maybe they like having a larger office, with a specialist nearby. It just kind of depends on what they're looking for.
I think that's a great place to mention. If you're watching and you have a pediatrician that you absolutely love, please feel free to mention it in the comments. We'll gladly, all soon-to-be new moms, I'm sure, would appreciate any recommendations from other moms who have a little bit of experience out there. So punch that into the comments and we'll keep an eye on those. And also, if you have any questions about maybe things you should look for in a pediatrician, let us know and we'll run those questions by Dr. Bruno. But I think in the meantime, another great point that you bring up is you said something about the fit. I mean, it's a lot of it comes down to, it's not much different than dating.
It really is.
It
really is. And because you're looking for somebody that is going to be closely involved in the lives of you and your children for the next 18 to 21 years. So fit is huge. When I give talks to expecting parents, the thing that I focus on with them, outside of all the hundreds of questions that you can ask a new pediatrician, is what does the fit feel like? So you need to get out there and meet these folks. And even if it's just meeting a couple, sometimes that's all it takes. But just getting in there, shaking hands, you want to make sure that you feel really comfortable talking with this person, that you can ask them any question you want to ask them, and no question is silly. So I think that connection with your pediatrician is really important. I want you to feel like I'm your friend, and I want you to feel like, you know, you're my friend, that we can talk back and forth about your children, and that we both want the same thing for them.
I think that's a great point, that whole common goal idea, that we all want what's best for the kid, but it's so true. The variance and the weird questions that you're going to ask over the years. I mean, I just think of some of the questions I've asked my doctor over the last 6 months. They're baffling to me. I mean, it's just, and you want to be able to have that back and forth, and someone who knows your child, rather than having that conversation necessarily with Google.
You really do. You really do. And you know, there really are no stupid questions, and it doesn't matter how educated and experienced you are, you're still going to have questions when you're a first-time mom. Being a pediatrician did not prepare me to be a mom, but being a mom has made me a better pediatrician. So for me, when my first was born, I was the senior doc in the clinic in the Air Force Base in Oklahoma, and I had the baby, and he had just projectile watery poop, and I was breastfeeding. So I thought, well, gosh, he must have it must be C. difficile diarrhea. It must be. So I brought it into my partner, my junior partner,
literally brought
the diaper in, and I said, Joey, I think that there might be something wrong with Jack, because look at his diaper. And he's like, well, Kristen, you know, that's what the breastfeeding poop looks like. I said, well, I don't know though. I think it might be diaper. No, that's what the breastfeeding poop looks like. So really, I share that story with my patients too, because I want them to know that everybody has silly questions, and there's no book for being a parent. It's all new.
So are you mom and pediatrician to your kids, or do your kids see a different pediatrician?
My kids do see a different pediatrician. And, you know, in addition to a pediatrician, they also both saw parents as teachers. Just because I think it's wonderful to have somebody else eyeing your kids. And as a pediatrician, I think sometimes I tend to maybe let things go a little longer than with my own kids. They tend to not worry as much about stuff. And so it's important to have somebody else looking over my shoulder and saying, you know, Kristen, I think that cold has been going on for a little too long. So
it is so true. I'm a child of a physician myself, and my mother was a nurse, and so it's the whole cobbler's children have no shoes thing, which made no sense until I figured out
my children have runny nose for 3 weeks.
My brother walked around with a broken arm for 2 days until the principal called and said, I don't mean to be rude or out of place here, but I'm going to have to report you if you don't get this x-ray. And sure enough, and my parents felt terrible, but they were like, we just swore you'd be fine. And we weren't trying to hurt the kid.
That's the way most of us are with time. That's not the way I was with my newborn, because I was obviously obsessing over his diapers, but as time goes on, so you really, so my kids do see their own pediatrician, and I picked them, met him, all that kind of stuff, just kind of the same thing that a lot of these moms are going to be doing.
Would you suggest, I know this has become an issue for some families that I know who have teenage daughters, and when they picked a pediatrician, didn't consider the conversations that their daughters would have to have with the pediatrician. So does gender play a role at all, or is it just...
I hate to say that I don't want to say that it doesn't play a role at all, because in reality, it does. You know, I was in partner with a male physician prior to coming here, and all of my female patients wanted to see me for everything, and all of his female patients wanted to see me, particularly for your well exams, or if you're coming in with any female complaints. I mean, and I was the same way when I turned 11, 12. I had a male doctor, and then I wanted a female physician. So I think, in my experience, it's very true with girls that teenage girls do want to see a female physician. The teenage boys don't seem to care. They really,
just generally
they really don't. I have as equally as many teenage boys as teenage girls, but then I also would see my partner's teenage girl. So, I think if you really love a male pediatrician, which I actually have a male pediatrician for my kids, and I have a boy and a girl, because I think he's wonderful. And if it ever came to the time where my daughter needed to see someone else, he's got partners in his office that are female, and so that would be an option for her. But so again, I didn't choose based on gender, but I think some people do feel like that's important.
And it all goes back to that question of fit. And how do you know if it is a fit? How do you go about meeting some of these doctors?
Yeah.
You're busy people. Do you just call up and ask for appointments?
You just call. We love to meet new people. Okay. Absolutely. You just call. So I've done Facebook interviews. I've had parents come into the office at lunchtime. Lunchtime is probably my favorite time to do it, just because it's easy for a lot of parents. They work during the day. After hours in the evenings, a lot of folks will do their new baby consults at the end of the day. We'll work you in however we can, because we want to meet you, because we want this to be a good fit both ways. If you don't trust me, then how am I going to care for your child to the best of my ability? So it has to be a mutually agreeable, respected relationship, and so that fit really is important. If you walk in, sit down and meet your pediatrician, and you're thinking, this person is a little weird, I don't think I can ask them questions, then it's not a good fit, and you need to move on to the next person. Even if they've got all the credentials on the wall, if they're 65 years old and just are not into breastfeeding and doesn't really get you and your concerns as a new mom, then they're probably not a good fit. And vice versa. Some people want an older, experienced pediatrician. Some want someone closer to them in age. So it's a very individual decision.
It is amazing the variety of personalities that you're going to encounter.
Absolutely.
All right, and so you were talking, I'm looking here at the list of questions that you gave me, and I'm referencing them diligently because I'm afraid I'm going to leave something off. But one thing that you mentioned, and I know this is the questions that you ask when you go in for one of these interviews, and the one that I know that I'm going to call out is the whole idea of going into a waiting room. Here you are with, and I think of my friends with these newborn preemie twins once they're back home. Do you take those well babies into a waiting room where there might be sick kids? I mean, how do you understand what the policy is within any sort of pediatrician's office?
And that's an important question to ask. When you go out on the website, as most of these moms will go out, and you probably have done yourself, and I did myself, is there's a list of hundreds of questions that you can ask your pediatrician. I have had families come in with that list of questions, and we've gone through all of them, and in the end I said, it's the fit, But some of these questions are important. I think that's a valid one. And so you want to ask that when you come to the office. Ask, is there a sick and a well waiting room? And when we talk about a sick and a well waiting room, if the waiting room is not really fully divided air supply wise, it's not truly a sick and a well waiting room. But it does make people feel better.
It makes you feel better.
It's so you have to remember that.
It's like going to the grocery store.
Exactly. Like just because your pediatrician's office doesn't have a divider wall up there doesn't mean that you're not going to get the same feeling of sort of being away from sick versus well. You're still going to have shared air, but when you have one side sick, one side well, or a little bit of a division with it, you're not going to be sitting right next to somebody coughing or right next to somebody with pink eye. So it does divide a little bit. But remember, it's not a true sick versus well where you're completely isolated unless there really is just a closed off air supply. The other thing that a lot of us do is have a separate entry for newborns. Here we have a separate door where the newborns come in and they check in at a separate desk and then get brought right into the room.
And is that pre-vaccination? Is that a pre-vaccination?
I do that until about 2 months.
Okay.
Yeah. Now, if we're in the wintertime, I might extend that a little bit later. But my policy has always been that babies, young infants, 2-3 months and under, don't sit in the waiting room. So if you come in, we just bring you right back into the room and do your check-in in the room. Okay. And so I think a lot of practices do those kinds of things because we don't want your baby exposed to things any more than you want them exposed to things. And in particular in the wintertime where we're dealing with flu and a lot of respiratory viruses, I don't want a 6-week-old sitting in my waiting room for even 5 minutes. I want the front desk to identify them when they check in and then just walk them right back to a room. And it's a very easy thing to do. So even if you don't have a sick and well waiting room, you can ask, oh, well, what do you do with newborns? Do you bring them back? My pediatrician personally didn't have a sick and well waiting room, but when we came in with my daughter for all of her well visits until she was 3 months old, we went right back to a room. We never sat in the waiting room at all. So there's different ways of doing it, but I think some sort of consideration for a newborn would be very nice.
And you also mentioned that it's worthwhile asking who's going to see your child once they're back there.
Yeah.
And that is a question I hadn't considered, but some offices have nurse practitioners, physicians. What are you looking to find out with that question?
Yeah, and that again is an individual thing. Some people are very just kind of comfortable with whoever sees the baby sees the babies. For me, that was an important thing for me, is that I did not want anybody seeing my child for the well visits other than our pediatrician, because after all, I had picked this person to help guide me through the next 18 years of my child's life. And so when it came to the well visits where you get all that education and everything, I wanted that to be my pediatrician. I was fine with the nurse practitioner for sick visits, but for that well stuff, I really wanted my pediatrician. And so that was something I looked for in an office. And there are I have some friends that say that every time they go to the office, there's a different person seeing their child. So there's a lot of rotation. So if you're not comfortable with that, then you want to ask that. How busy is the office? How full is the doctor? Is the doctor so full to capacity that every time you come in for a sick visit, you always get a nurse practitioner or a partner? I think that's really important. I personally, my partner and I don't have a whole lot of overlap. We mostly just see our own patients because that's the way we like it. But every parent is different in terms of what they want. So, but I think it's important to ask those questions.
Another question has to do with the sick visits. Who will see your kid whenever there's a sick visit, and how does the office handle those sick visits? I mean, if you call up at 8 o'clock in the morning and say my kid's eye looks a little red, will you be seen that day, or does it just vary by pediatrician?
It varies by pediatrician. I personally think it's very important for you to be able to contact your pediatrician all the time. And that may mean, and I hope no pediatricians out there are freaking out that I said that, I don't mean that you should call them by phone at home at 11 o'clock at night, but there should be a way that you can contact somebody representing your pediatrician, whether it be the after hours exchange, a nurse in the office, or the pediatrician themselves, all the time. Because most of us don't want our healthy, cute little 2-month-olds going into the emergency room for spitting up in the middle of the night during flu season. That's a really bad thing. We don't want you there. So we want you to be able to contact the office and get in. And so I think ideally, if you have a sick visit, they should try to get you in the same day, especially if you're concerned. Sometimes it's an older child with a cold, and we might say, well, I think that can wait. But really for us, if a parent really feels strongly about wanting to be seen that day, even if it is a cold, it's important to me that we bring you in and we check you out. So if that's important to you, if it's important to you to have that same day access, then that's something you want to ask, because there are some practices that are very busy that may not be able to offer that, or that if they offer it, it's going to be with a nurse practitioner, which is fine. If they have that physician extender in the office, it's wonderful. So you just want to ask those questions, kind of get a gauge, and you can talk to other parents and get an idea of how busy these practices are, and whether you feel like you're going to get that kind of individualized care that you want for your child.
And when does that care start? When will a pediatrician first see a baby?
Yeah, so this varies just a little bit. I say about 2 days after they go home is when I see babies in the office, and I think that's probably more common.
You get it out that soon?
2 days after they go home from the hospital.
Oh my gosh, I hadn't even thought about that.
2 days after you go home. So, and the reason for that for me is you've now just gone home from the hospital. If you're breastfeeding, your milk has probably just come in. Jaundice is peaking because that hits at about 72 to 96 hours of age. So all these things are happening after your 2-day stay in the hospital. And so if I wait a week to see you, then there's an awful lot of stuff that I'm missing. So I think it's very important to get babies in to see the pediatrician within a couple of days after they go home, especially if they're breastfeeding. Formula fed, maybe you could go a little bit longer, but I still really don't like to go longer than about 2 or 3 days with the formula fed babies. Just
when you say the breastfeeding you want to see sooner, why is that?
So breastfeeding babies, they lose more weight in the beginning. So you can lose up to 10% of your birth weight in the first 2 weeks of life. So there's a lot of weight loss with breastfeeding babies, and probably most breastfed babies do lose somewhere in the range of 5 to 10% in that first week of life.
Does the same go for mom?
Yes.
That would be
I had
nice
a pretty
to
good
know.
experience with it, but I will not say it's across the board because I've had many moms tell me that breastfeeding does not make them
I've
lose weight.
had people say
But-
both. Yeah.
Yeah.
To say to both ends.
But
They're
I
like,
ate for
"Hey,
3 while breastfeeding and still lost weight. So I don't know. Who knows?
Duly
Who
noted.
knows? But it's certainly good for baby.
So I'm very sorry. I completely, very rudely interrupted you with
No.
a non sequitur. So the whole breastfeeding, if
Yes.
so the baby can lose.
They can lose weight.
5%. Okay.
Jaundice is more common in breastfeeding babies, and again, peaks at 72 to 96 hours. So if you have a vaginal delivery, you're going home when the baby's about 48 hours home of age, which means then the jaundice gets worse after you go home. And so if nobody's following up and seeing you, you're being some problems there. The other thing is that especially when you're a first-time mom and you're breastfeeding, your milk supply doesn't really start coming in until after day 2. Most of us it's day 3, some of us it's day 4. And so you're going home having learned how to frequently nurse a baby who gets a little bit of colostrum every feeding, which is very different from actually when your milk comes in, you're now fully engorged, and you're now having to truly get a lot of milk into this child's tummy. And so it's a big change. So I think for that reason, it's really important to see parents and babies within a couple of days after they go home. And there's a million questions when you go home from the hospital. So if you don't see a pediatrician in a couple of days, you're going to be on the internet, Googling, reading your books, trying to figure out the answers to all these questions.
I feel like I need a pen right now. We have a breastfeeding episode coming up in a couple of weeks that I now have so many more questions for. But go on, I'm sorry.
Oh yes, I can tell you. I could talk about breastfeeding until I was blue in the face.
And
so.
you said that that's a really important topic to understand your pediatrician's
It's a very important topic, and I feel very strongly about this personally because breastfeeding is very important to me. I want all of my patients who want to breastfeed to be successful. And to me, that means that if you need me to weigh your baby every day, if you need to come into the office and have me help you with your pump, if you need me to help you latch the baby, I want to do that. Not all offices have that level of support. There are some offices that have a lactation consultant, lactation nurse in the office. I came from an office that had that, which is a lot of where my knowledge comes from. And having her to lean on was wonderful. But she wasn't 100% because she was there a couple days a week. So then the rest of it kind of came to me. So if breastfeeding is really important to you, you want to get a feel for how your pediatrician is with breastfeeding. And I would ask that question, hey, if my baby loses 12% of their birth weight, but they're doing okay and we're waiting for my milk to come in, are you going to tell me I have to get formula? So, those things really matter depending on what's important to you. So, you don't want somebody that's going to shove breastfeeding down your throat if that's not what you want, but you want somebody that's going to support you and be there for you.
Rumor has it, it's not that easy. And did I see we have a question as well?
We do. Jocelyn asks, what if you're having a C-section and are staying in the hospital longer? Do pediatricians come to the hospital?
Yes, we do come to the hospital. So I don't know the exact numbers anymore of pediatricians that go in and around on babies. It is definitely dwindling. There are more pediatricians that are choosing to kind of not see babies in the hospital, but have a hospital to see the baby, which is absolutely okay. Hospitals are wonderful. I came from that world. It's great. We know what we're doing.
I know a bunch of them, and I love all of them.
They're wonderful. It's great. I did a great job as a hospitalist. I think everybody out there who's doing it does a great job. And then you would see your pediatrician when you get home. And again, for me, I don't care if you have a C-section or a vaginal delivery. I still want to see you a couple days after you go home. But yeah, as a C-section mom, if you're in the hospital for 4 days, somebody's going to see you every day that you're there. And it may be your pediatrician, or it may be the hospitalist. And either way is absolutely okay.
And just to clarify, I know that hospitalist is a word we use regularly in the hospital environment, but it's something most people don't know what they are. But they're board-certified physicians.
Board-certified pediatrician, exactly. Pediatrician who works primarily in the hospital setting. So when I was doing this, we covered the nursery and then covered the emergency room. So no, we didn't do the inpatient stuff. We just covered nursery and emergency room. So if you're doing that, you're getting really, really good at baby stuff. Going to deliveries, kind of a little bit of a neonatology kind of role sometimes. And there are some hospitals that will also do floor work as well. At some of the bigger children's hospitals, they'll do floor work as well. So that's what the hospitalist role is.
So they're fantastic and have a great range of knowledge when it comes to newborn care. I know that at St. Louis Children's Hospital, it's St. Louis Children's Hospital physicians who are at Barnes Jewish Hospital for deliveries, and also over at Missouri Baptist as well. So I can't speak for any other places, but those two I know.
Yes, and most of them will do, the hospitals in general kind of come from the children's hospitals, which is a good thing. But so that brings up another question then. Is it important that your pediatrician comes into the hospital, not comes into the hospital? And that's, again, one of these personal choices, because there are some people that really, really like the idea of having their pediatrician come into the hospital and see their baby. And I get that. I personally love to go to the hospital and see babies in the hospital, because then I feel like, I'm the first face that this mom gets to see and show her baby to, and I'm the first person they get to talk to about what's going on right after the delivery. So I think it's a really nice place to start. So if that's important to you, then when you interview pediatricians, you want to make sure you ask, do you see the baby in the hospital? If you don't, who does? Is it your partner? Is it the hospitalist service? And then which hospitals do you go to? Because we don't go to all of them. Some of us kind of pick and choose which ones we round at.
Okay. And how will they know, how will a pediatrician, if they don't necessarily go to the hospital, either way, I guess if they do come to the hospital, how do they know you've delivered?
Sure, so the hospital...
Are they supposed to be on the text string where you announce the name and everything like that?
That would be nice.
Yeah.
No, so...
it would get you their cell phone number early too. That's kind of brilliant.
So actually, and I get this question all the time, is how do you know that I had the baby? How do you know you have to come in and see me? Well, the nurses call. So if you are, and sometimes there's a little bit of a snafu here and there, but for the most part, you go in, you tell them who your pediatrician is. They will call the office and say, Dr. Bruno, you have a new baby, Mrs. Miller delivered her son. And then for me, I would go into the hospital to see you, because I see babies there. If you weren't a physician that went into the hospital, then you would just let the mom know, you need to make an appointment and come and see me a couple days after you go home. So yes, they contact us from the hospital and let us know. You do not have to call your doctor personally, although I have had a mom that called me to let me know that she had the baby, and that was fine too.
That woman was on top of it.
She wanted to make sure.
That's
It was
amazing.
she was a little concerned with the transition in the hospital. Did they know Dr. Bruno was on staff? Did they not? And so she just called, just to make sure.
I can't remember to call to update bills right now. I don't know how you'd remember that, but I guess maybe the checklist.
Yes, it was her third baby too, so she.
She knows
there
the
were
drill.
less. Yeah, there were less things. Yeah.
Gotcha. And so what if you wind up, you've gone through this whole process and you have interviewed all of these doctors, you found what you think is the perfect fit, and you get, whether it's weeks or months or years down the road, and you think maybe this isn't the right fit anymore. What do you do? Are you locked in, or do you just start over?
You start over. It's a very hard decision to change a pediatrician, just like change with anything, just like moving or changing to a new school. It's what you're comfortable with. I would say that, if there's just something that maybe happened once with your pediatrician that maybe rubbed you the wrong way or you felt uncomfortable with, it's probably a good idea, if you have a good relationship with that pediatrician otherwise, to sit down and maybe talk with them about it before kind of jumping ship. Because maybe there was just an issue with the office that day. Maybe
and
somebody
everybody
was
has
grumpy.
a bad day.
Everybody has a bad day. So I wouldn't throw in the towel on a pediatrician that you've been with for a long time, because switching, while you may get something better, but you could also end up with something worse. And you may be throwing a relationship away that was really valuable to you and your children. So I would start with talking to the pediatrician. If, things have changed with the office over time or changed with the pediatrician over time, and it's just not a good fit anymore overall, then I think it's reasonable to look and try out another pediatrician.
I think that's great advice on all fronts, and I'm looking over all of the questions, and for the most part, I think we've covered most of the bases. Do you have anything else that any other last minute recommendations or final recommendations you'd give folks out there who are embarking on this process?
No, I think the big thing is just making sure that that this is a good fit. That's the most important piece of advice for me, is children are not little adults. Not only that, a pediatrician is not just taking care of your child, we're taking care of your entire family. We know the names of your dog and your cat and your grandma and the aunts, and we know what your family setup is. And so it's a whole picture for us. We want to make sure that you and your family are healthy long term. And so I think that fit is just really important. And then pick out the things that are important to you individually. If breastfeeding is important to you, ask about breastfeeding at the office. Do they have a lactation consultant? Is your pediatrician good at breastfeeding? Did she breastfeed? Maybe she's great at it and you don't even need a consultation from that. If it's important for somebody to come into the hospital, then don't pick an office where the pediatrician doesn't come in. Another thing that I think is really important is that access we talked about. As a hospitalist, I did see patients that would come in the ER, 1 or 2 o'clock in the morning with a cold, and I would say, well, did you call your pediatrician? Well, I couldn't get a hold of them. And that to me is kind of heartbreaking. Not because I didn't want to see somebody at 2 in the morning, but more because this child could have seen their pediatrician the next day. The mom could have talked to the pediatrician on the phone and gotten some good advice, and then you would keep the continuity of care and that physician-patient relationship. That family care is still established. And instead, this poor family had to take their child at 2 in the morning to an ER because they couldn't reach their pediatrician. So make sure that whatever office you choose, that you know how you can get a hold of somebody, whether it be a nurse triage or your doctor, 24 hours a day.
That is such valuable information. I'm glad you brought that up because I would have completely forgotten about it. I know that at the hospital we do see people regularly who use the emergency room as a source of primary care.
Yep.
And I know in some situations that's unavoidable. There are just some families
Sometimes,
that are
right.
that for whatever reason that's how it happens. And now we are seeing urgent cares and convenient care clinics that are coming up. And while all of these places exist for extremely good reason, it doesn't take away from that incredibly valuable relationship a child has with their pediatrician, or an entire family has, to your point, with their pediatrician over the course of those 18, 21 years. Because,
right.
I mean, when you look at things like even asthma, diagnosing that, I'm sure, is so much easier if you have the full history and you're
Right.
not a different practitioner or a different clinic seeing a child for the first time every time you see them.
Absolutely.
So thank you for bringing that up, and thank you so much for joining us. And I think
Thanks.
We'll tell people one more time, ask your friends for recommendations.
Yes.
A lot of them will have great ones, and they know personalities very well. Another thing to do, you can call 314-454-KIDS, and I hope I don't butcher this. I'm pretty sure it's 5437. I'm trying to remember the number. Is it 5437?
Yes.
314-454-5437 is the access line at St. Louis Children's Hospital, and the operators there are great at giving you some ideas of people who are in your area who might be pediatricians that would be convenient to you, and connecting you with those physicians as well. And they know scheduling, so you can always check those places. So thank you again so much, Dr. Bruno, and Purely Pediatrics. Thank you. I need it. We'll be back a week from Friday with another episode of From Belly to Baby. So thanks for joining us. Have a great holiday weekend.